Hi everybody, Dr. Nelson Bolnash here. This is my friend Cohen. Cohen, great to meet you.
Nice to meet you.
I'm happy to have you here. I'm sorry it's under the current conditions. Tell me what happened.
I was playing basketball and I jumped for the ball and then I fell on someone's foot and rolled it.
I'm sorry that you had that accident. I'm sure that's quite painful. I'm going to do what I can to make it feel much better and have it be much more functional, meaning it will function much better than when you came in. Does that sound good? Mm-hmm. All right, sir. Let me have you lie on your back here. Now I'm going to have my videographer, who is Cohen's mom, attend to the videography component of this. And the first thing I want to do is I want to look at your ankle. You're welcome to come much closer if you want. So you see the bruising that indicates there's been tearing. That's more than likely some of the tendons, and he's quite swollen here under what's called the lateral malleolus, which is the structure here. Now, if you come around here briefly, you're going to see that he has, sorry about that, no swelling, no bruising throughout here and here. And now I'm going to have you swing around here. Hit this angle right here. So all of this that you see me grasp is swollen and it's hot. So he absolutely has swelling here. I'm going to be very cautious. Nobody likes their tissues to be handled even firmly when they're injured. I'm going to gently go into internal rotation, which means I'm going to go in this way, and he has almost no ability at the hip joint to take his ankle in this direction. Now we compare here. He has beautiful range of motion. So the first thing that I'm going to do, and I think it's very imperative that I say this, is when you injure an ankle, you have also done damage to the knee, to the position, if you will, the kneecap, and to the hip joint. Once again, look at how, as I rotate his hip, he has almost no ability to take his femur in internal rotation, which is this way. So the first thing I'm going to do to make it better for him and for me to palpate, to evaluate these structures, I'm going to reset his hip. So forgive me, I'm struggling a little bit here. I've just had a hip replacement on the right and I'm not yet walking particularly well. Come right over here if you would, and I want to show you some things. Now, you're going to hear loud noises. This is called a drop table. It allows me to do a very fast adjustment and have the table absorb the shock, so he's in no pain from the process, okay? So as we feel or palpate all of this, he's actually got a little bit of swelling in here. You feel that puffiness in there? We compare here, nothing. Can you feel the difference? How puffy this is? That means he actually did some damage to the tissues that comprise the hip joint as well. And I'm going to take this and put both arms up there so you don't get it caught under the table. So here's what we're going to do. And don't let this frighten you. You're going to hear a loud noise from the dropping of the table. I'm going to come in here, and let me do this one more time. That's all he has. About 20 degrees of rotation. Calibrating the drop force required. I'm going to come in here. Boom. Now, with one precise drop. How does that feel now? Like you have a lot more range of motion in through here?
Yes.
Yeah. So, let me get this cleared up a little bit more. Do you mind removing your phone? I can put it here for you if you like. We're going to come in here. Come in here. Look at the difference here. Now, we're also going to get some muscles here in the lower abdomen and get them to release. This will make it much more comfortable for him in a moment and for me to reset his ankle. Good. Now, look at the difference here. I'm going to get a little bit more here. Reset the pubic bone. There it is. Look at this now. How does that feel?
Good.
Much more mobile?
Yes.
Any pain in here?
No.
Beautiful. Now we're going to go down to the knee and then to the ankle. So his kneecap should be freely mobile. So it goes this way, this way, this way, this way, this way, and this way. And he has no motion here, no motion there, no motion here. So his kneecap is stuck. We can't have that. The kneecap is called a sesamoid bone. It should move freely above the knee joint so as to give leverage so you can extend and flex the knee appropriately. So what we're going to do is, there's a swath of tissue here, goes down here. It has hiked this bone up this way and this way. So I'm going to free that up with a technique that I developed called torque reset. You can hear various fascial releases. Comfortable?
Yes.
So let's see what our status is here. Look at this. Can you see that, Adrian?
Mm-hmm.
That is imperative. If that kneecap gets stuck, you're set up for the next major injury. This bone must be freely floating. And sorry, you got something, medicine or something? Yeah, it's a little sticky. So now what we're going to do is we're going to lift this up. We're going to check the different components of this general area here. One of which here, this is moving very well now. It was not yesterday when I worked on you. Okay. This is the proximal fibula up here. And today it is working well, but we're going to clean it up. You heard that pop. Look at this now. Once again, very important. Bones form joints, and joints, when interfacing together, have to be able to move freely. This is fantastic. Kneecap is moving well, and let me get under here. I'm going to clean up a little bit of this. Look at that difference. Beautiful, beautiful, beautiful. Now, it all starts to get buggered up down in here. So, did you get a good picture of this? Look at this. So this is blood in the tissues, which means he's done some tearing of the muscles, possibly the ligaments and the tendons. We're going to be super, super gentle. I don't want him to jump off the table and have both his mom and himself tag team me with punches that only a mother can throw. So I'm going to be very, very gentle. And as you notice, as we go down here we go. Boom. Now it's very swollen and not moving well. So up here, we have beautiful motion. I'm going to be super gentle. No external rotation and no internal rotation. External, internal. So I'm going to be super gentle. This now is called point holding, where I'm gently holding a point here on the lower psoas muscles. And in doing so, we're sending a message to the brain. And that message is, let's chill out and relax some of this traumatic stress on this portion of these muscles and tendons. So once again, if I take my finger, thumb like this, put it gently down here and attempt to rotate this way, which is internal rotation, I have no internal rotation. Now, why I don't like this, of course, is because it compromises his range of motion. So I'm going to just gently hold. Nothing crazy, nothing dramatic, no risk of further damaging his tissues, tendons, ligaments, and muscles. Now, what I'm waiting for, so you're clear, is you have a mechanism where the muscles meet the tendons in this area, and it sends a proprioceptive message to the brain saying, way too tight. And as we just gently hold this, the brain will recalibrate the amount of tension. And we don't want all tension gone because this tissue has been compromised. So if it's too loosey-goosey, then he ends up having a very unstable ankle and lower leg, and he will likely fall, trip, or lose his balance. Now, is this okay? Look at the difference here. Now, that's not perfect, but it's dramatically better. Did you experience much less pain?
I did not experience any pain.
Any pain. So we have a complete reduction now of pain in this area where we started to damage the tissues. Going to be super careful because we don't want to release all of the tightness. Some of it has to stay there so he doesn't have it give out on him when he's walking. Once again, point holding. This is a technique I developed many years ago. It allows the tissues to bear weight if we don't have too much tearing or compromise, and it allows me to increase blood flow, lymphatic drainage, oxygen delivery, nutrient delivery. Gently. Now, look at this. Look at this difference. I'm going to hold one more point here. I'm going to be teaching this again now that the pandemic appears to be mostly over. So next year I will be teaching, certainly here throughout the United States and possibly worldwide. This is very, very effective and help people heal quicker from injuries like this. Okay, very gently, look at this. Some of you may be thinking, well, he still has restriction. Of course he still has restriction. Once again, we're finding that point at which he has better range of motion, but not where everything is totally loose, because then he has no stability and will sprain this ankle again. Okay, so I'm going to gently straighten this up, and I have nearly 35 years of experience doing this. I'm going to raise the table, and I'm going to do something that is important. We know that we have tearing through here, okay? So I'm going to create a little bit more mobility, but not so much as to compromise the stability of the foot, ankle, knee, kneecap, and the hip joint. So all of this is compromised. It's all locked down. I am very gently going to test him. How is that? Does that hurt?
No.
I'm going to take just a gentle tug at the very gentle, not a lot of force. It's going to look like this. Relax. You okay with that?
Yes.
Okay. If the ligaments are really torn, tendons are really torn, we would not do that technique. We don't want to compromise him more. And we're almost done with what I'm going to do today. I want to be very careful, gently wake everything up. I'm going to have you come down here. I want you to notice something. Put your focus right here. And as I take this and go into eversion, which is to take the ankle and go this way, in other words, this way here, he has virtually no eversion. Super gentle here, super gentle. You okay?
Yes.
There we go. Now look at the difference. Is that perfect? Not at all. Not at all. But it's a start, and it gives him a little bit more range of motion, which is critical, because without slightly increasing the range of motion, he cannot effectively walk on this foot and ankle. Gonna come in here, just gonna loosen some of this up. Once again, the object is not to eliminate all the stress, all the inflammation, and all of the lockdown. It is to initiate a process that gives him slightly more range of motion, strength, and freedom to move. I always like to keep a person walking if possible. If his ankle is really weak, then obviously we have to either tape it, cast it, or put it in a boot to protect it. He can walk on it. I'm going to let him walk on it and be very, very careful. Is that okay with you, sir?
Yes.
You okay now? Look at how much that's improved. That's huge because that gives him some flexibility in walking where he's not so compromised if he steps off of a curb inappropriately, if he goes up a step inappropriately. So he'll have some more flexibility, resiliency, so that he can begin to walk gently, not excessively. You want to do some walking every hour while you're awake, but not too much. And I'm going to stop right there today, sir, and I will see you on Monday. Monday, I'm going to give you some things that we'll talk about later, next Monday or Tuesday, if you're able to get in. And that's going to help decrease inflammation. I ran him in through what's called a pulse session, which is based on Tesla's pulse work. So we were running a current in through here that increases oxygenation, lymphatic drainage, elimination of waste, and also strengthen the cells so they'll be more stable. And pretty quickly, I broke my foot after I had a weightlifting accident where I had 9 to 12 fractures in my left foot, and I was healed by x-ray in 1 month. So we're gonna get you healed quickly and effectively so that you can gradually increase the mobility, walking, standing, and meandering about as you need to conduct life. Thank you for watching my show.